Welcome back. March is recognized globally as Endometriosis Awareness Month, a time that's dedicated to raising awareness about endometriosis, a chronic condition that affects millions of women worldwide. Now, despite its prevalence, many women continue to suffer in silence, often experiencing years of pain and misdiagnosis before receiving proper medical attention. The condition can have a serious impact on a woman's quality of life, affecting everything from daily activities to fertility as well as overall well-being. Raising awareness and encouraging open conversations about women's health is therefore crucial. Joining us to help unpack this condition, its symptoms, as well as the importance of early diagnosis, is Dr. Cornelia Mdifong. Doctor, good evening and welcome.
Good evening, Nina.
Thank you so much for being here.
Thank you. It's always a pleasure.
Well, as I mentioned, March is globally recognized as the month in which endometriosis awareness is done. So talk to us about, firstly, explaining what endometriosis is and also why it's important to, as I mentioned, have more open conversations around this condition.
Yeah, that's a great question to start with. Endometriosis is a gynecologic condition, and it refers to a situation where endometrium-like cells or tissue similar to endometrium grows outside the uterus. So what is endometrium? The uterus has what we call 3 layers. The endometrium is the innermost layer, then the myometrium, and then the outermost layer, okay? So the endometrium, the normal natural position is to line the inner surface of the uterus. So in endometriosis, certain cells or tissue that look like that endometrium, they grow outside. It can be on the outer surface of the uterus. They can grow on the surface of the ovaries. They can grow on the surface of the fallopian tubes.
Right.
Yeah. So because they are similar to the endometrium, they are under the influence of the hormones that affect the normal endometrium that is inside the uterus. These ones that are growing outside, they also respond to hormonal influences. Now, why is it important? It causes a lot of symptoms, but the most important effect is that it can cause a woman to be infertile or to be unable to fall pregnant. And we know what that means in the society. The whole humanity is about bringing children into this world.
Right.
And whether married or not, there is an age when people are no longer saying teenage pregnancy. They are saying, you are a mature woman, give us a child. And then when a person cannot have children because of endometriosis, it becomes important.
Yeah. Many women say that, when their symptoms are dismissed as, normal period pain, because pain is one of the more common symptoms associated with endometriosis as well. So that's why it's so easily dismissed. But what are some of the warning signs, doctor, that could indicate, it's endometriosis rather than just a typical menstrual discomfort that you're feeling?
Okay. So menses, depending on different people, the pain can be just a discomfort, like you said.
Yes.
And then what we also call normal pain. But when endometriosis is involved, it's much more severe.
The pain levels.
The pain level than what somebody will call normal pain. Okay. Then what are the other warning signs or risk factors? It runs in the family. And remember, we're talking about women now.
So this is genetic?
Yes.
I think that's the first time I hear that.
Yeah. So if there has been a family history of endometriosis in a sister, there is a chance that it can happen in other female siblings.
Yeah.
And then one other thing that can make you suspect endometriosis is that you have frequent menstruation. This is when the cycle is less than 21 days. What is called hypermenorrhea.
Yeah.
So every now and then you're menstruating, and people will wonder, why are you always having
So
menses?
irregular period is
Yes,
also a red flag.
Yeah, frequent menstruation,
Yeah.
which is a form of irregular.
Yeah.
Because irregularity can mean that it's not coming once a month, which is the normal regular
Yeah,
for every woman. But once it begins to come too frequently, then we need to question. And then chronic lower abdominal pain or chronic back pain. Okay, some women may present with bloating or nausea. Yes, that also can make you to suspect that there's something wrong. Some studies have considered, I mean, they've tried to look at a woman that is thin built with a low BMI, that they are more likely to present with endometriosis. Yeah. Yeah.
Let's say now a woman has been diagnosed. It's been found it's not just this period discomfort or menstrual discomfort. What are the treatment options for endometriosis, doctor? Because you did mention that severe cases leads to infertility sometimes.
Yeah. So what we can say is that when a woman comes with lower abdominal pain or very severe menstrual pain, and all these symptoms that I've mentioned, even including what we call pain during sex, okay? The bottom line is pain. Pain is the major presentation of endometriosis. So what do? You have to treat the pain. Okay. Now, if you treat the pain and it doesn't seem to go away, and you tie it to these menses around that area, a good GP should be able to think further and say this could be endometriosis. So that is an assumptive treatment of pain. But then you need to get to the diagnosis. So how do you diagnose? You can do sonar or ultrasound. You can do MRI, magnetic resonance imaging. Okay? If you do this and there is a suggestion that it is endometriosis, then we can move to what we call laparoscopic surgery. Now, that surgery or that laparoscopic procedure is like killing one bed or two birds with one stone, rather.
Right.
It will help you now to confirm that this is endometriosis. And then at the same time, you can treat. Because what is laparoscopy? You are using instrument through a small cut, not the major open abdominal surgery. And the instruments are having camera. And it will be able to help you now to see that, oh, I can see something that looks like endometriosis here. This tissue looks like endometrium. It's on the back of the uterus, it's on the ovaries, or it's on the tubes. And then with other instruments, you can sort of, should I say, clip these things off and bond them at the same time. And then you can also suck up the tissue that you clip, because you can then send it for histology for them to really study it and say it matches with the endometrium. That's why they say tissue similar to and responds to hormones. So treatment-wise is analgesics, because the person is having pain, okay? And they can also try hormonal therapy. But sometimes the hormonal therapy, in this case, it can be counterproductive. And then the surgical, and surgical is not the major opening of the abdomen. We are now doing what we call minimally invasive laparoscopic surgery,
Dr. Difon, unfortunately, we're out of time, but thank you so much. It's always very insightful speaking to you. Thank you so much for being here this evening.
Thank you. Thank you very much, Nina.
That was Dr. Cornelia Difon speaking to us about endometriosis, as it is Endometriosis Awareness Month during the month of March. On that note, we wrap up today's edition of the show. We're back tomorrow. Join us then. Good night.